Hi everyone, welcome to another episode of Political Sports Desk. I'm Mark Wiseman. This week we're going to talk about the competing narratives between the UCP and the NDP around safe consumption sites. More specifically, we're going to focus on the communication battle between the UCP and the NDP around the UCP government's review panel of safe consumption sites in Alberta. This deeply divisive issue has been simmering in Alberta politics since the introduction of safe consumption sites in 2017. Safe consumption sites are quickly becoming a very important issue because of the tremendous loss of life due to the opioid epidemic that's gripping the province and the rest of the country. The implications of this review are important, and the actions it will be used to justify will have life and death consequences for real people. And now for a bit of background on this issue to get into it. Since the beginning of 2016, over 17,000 people have died in Canada as a result of drug overdoses related to opioids. And drug overdoses are the number one cause of death of men and women between the ages of 30 and 39. And just prior to filming, the Alberta government announced that 904 people have died from overdoses from January to October of 2020, which at the time of filming was more people than have died from complications related to COVID-19. These grim statistics have forced governments to embrace a greater use of harm reduction services like safe consumption. The first safe consumption site opened in Alberta at the end of 2017. The idea was to minimize overdose deaths and minimize the spread of diseases and other health problems related to drug use, and to use the services as a jumping off point to promote other social programs like housing, employment, and treatment services. Safe consumption, a harm reduction technique, offers a safe space for users to do drugs, clean paraphernalia to prevent infection and the spread of disease, and these services have a health professional present to help the user in the event of an overdose. Since then, safe consumption services in Alberta have grown to as many as 7 permanent and mobile sites across Alberta in Calgary, Edmonton, Lethbridge, Red Deer, and Grand Prairie. The rapid increase in safe consumption sites across Canada in the last decade started after a landmark ruling by the Supreme Court in 2011, which constitutionally protected the right of the Vancouver Insight Safe Consumption Site to remain open. The federal government under Prime Minister Stephen Harper was trying to shut down the Vancouver Harm Reduction Facility, and the Supreme Court found unanimously that these sites were in the best interest of public health and were allowed to remain open. The UCP's journey on this issue began right after the Sheldon Schumer Safe Consumption Site opened in 2017 in Calgary, where almost immediately there were reports of negative effects of the facility on the people and businesses surrounding the Sheldon Schumer, as there were reports of increased crime, social disorder in the area as a result of the site opening. A good starting point for talking about the political game of safe consumption review is the UCP election platform, back when they released it during the spring of 2019, just prior to the election. In the platform, they have several points where they discuss the issue of drugs, drug addiction, and safe consumption. On page 52 of the platform, the UCP outlined their opioid response strategy. In the opioid response strategy, the UCP says that the cause of the opioid crisis in Alberta is the long wait time for surgeries, because people are waiting for surgery, and in the meantime they are prescribed powerful painkillers that create addiction problems. It should be noted that researchers have found that overprescription of opioids like fentanyl and OxyContin have created a cycle of demand and addiction as being the main cause of the epidemic, rather than hospital wait times. The UCP outlined a number of pledges, including creating an associate minister for mental health and addictions, investing $40 million to launch their opioid response strategy, which expands support for opioid treatment centers, more access to detox beds, mobile detox programs, and funding for virtual opioid dependency programs. And they pledge to work with doctors to find ways to reduce opioid prescription. And they also had a section on the supervised consumption sites in the election platform on page 54. In the platform, the UCP say that they want to see those with addictions helped, but they also want their parks, neighborhoods, and communities to be safe. They say they will take sensible, targeted, and compassionate approach to the issue of supervised consumption sites. In the platform, the UCP pledged to only endorse new safe consumption sites if there have been extensive consultations with affected communities. They will only endorse new overdose prevention sites if they provide clear plans to provide treatment services. The UCP says it will conduct a, quote, evidence-based socioeconomic analysis of the existing drug consumption sites. In this, they will consult with local communities, police, municipalities, and others on the location of existing sites to determine if they are optimal. And if better locations could be found that would reduce the impact of crime, discarded needles, and other negative social and economic impacts on local neighborhoods, they would move the sites. Many of these election pledges on safe consumption are directly related to the very real issues that many of the communities surrounding the newly opened safe consumption sites experienced. So, if we're looking for goalposts in this discussion, during the election, the UCP said they were going to invest in long-term treatment and rehab, they were going to keep safe consumption sites, but they were talking about evaluating the full socioeconomic impacts, and they would consider moving the sites, and they would rigorously study the subject so that the best outcome could be reached for all. So now that we've set the stage for this competition, let's see how the events over the last year have played out. So, even though the election platform seemed to indicate that the UCP would ultimately keep safe consumption sites, during the 2019 provincial election, there were actually accusations made by the NDP about Jason Kenney and the UCP. The NDP were trying to appeal to their base voters by saying that they believed that Jason Kenney would eventually shut down safe consumption sites if elected. And their evidence for this was based on Jason Kenney's comments in the Lethbridge Herald in 2018, a year before the 2019 provincial election, saying that he doesn't believe safe consumption works, and that he doesn't believe that, quote, helping addicts inject poison into their bodies is a long-term solution. When asked about this rhetoric around this subject during the 2019 election, Kenny's tone softened quite a bit, and the election platform signaled that he would keep the sites open if elected. However, after the 2019 election, and after the UCP took power, things began to change again. We began to see a real shift in the communication strategy of the UCP away from support of safe consumption. This is the first moment where the public conversation on supervised consumption began to be split by the UCP and the NDP in two very different communication narratives. This moment occurred in August 2019 when the Supervised Consumption Review Panel was unveiled and the scope of their work was announced. One of the interesting developments about this panel's investigation is the scope of their work would only be limited to the negative impacts of safe consumption on neighborhoods. There would be no assessment of any of the benefits, and the effects of housing and homelessness on the neighborhood would also be left out of the analysis. Instead, the panel would study property value impacts, business impacts, crime rates, needle debris, complaints of social disorder, emergency calls, and a host of other indicators. UCP Associate Minister of Mental Health and Addiction, Jason Luan, said, when asked about the limited scope of the study, they had already heard about the benefits of safe consumption, and the science behind it was well established. So it didn't make sense to rehash it, and that the concerns of the neighborhood residents and businesses were largely ignored initially, and this study would bring balance back to the conversation. This was a good tactical play by the government because there is a mountain of research and evidence from doctors, health professionals, researchers, and even the Supreme Court of Canada that says these sites are net benefits to the community. By sidestepping all of this information in the review, the UCP could create a forum where all of the positive information would be held out, and where only the negative aspects could be examined. The UCP could use this panel to craft a political and emotional case for their followers to support political action against supervised consumption, despite all of the scientifically proven benefits. The NDP countered with their talking points, calling the analysis of the services clearly biased. There were also a number of concerns with the appointed members of the panel, representatives with backgrounds in law enforcement, recovery-based care, and business, were overrepresented in this panel, and there was no one on the panel that has worked at or accessed services from a safe consumption site. This is a UCP strategy that we're all by now very familiar with now that they've been in power for almost 2 years. The strategy of creating a panel to study a subject, but the members of that panel overrepresent the UCP's desired outcome, which makes it difficult to independently study and objectively evaluate a subject from all of the necessary perspectives. Combine this with the strategy of limiting the scope of the panel's study, in this case, to study only the negative effects, so that the panel can't possibly come to an unbiased conclusion. And then they use the findings of the panel to rationalize political decisions. The brilliance of this play is that people who aren't following these issues closely and don't know about the limited scope of the study will hear that an official government panel evaluated something and might accept flawed findings as actual truth. By using this strategy, the UCP can turn people against something that is supported with real scientific data. We've seen this strategy also deployed by the UCP with the Curriculum Review Panel, in which no teachers were involved in the creation of a new school curriculum. And we also saw it with the McKinnon panel that was created to study the province's finances. The panel was limited to only finding ways to cut services, without being able to consider ways to increase provincial revenue. So the Safe Consumption Review Panel would ultimately begin their work, and they would travel to various sites in Alberta where safe consumption was happening in September 2019. Now, let's fast forward to late January 2020. So the real game began at the beginning of that year, after the review had been done, with a press conference by Jason Kenney where he previewed to the media what the reports of their evidence-based report found. Kenney's wording in the press conference also introduced for the first time the idea that these supervised consumption sites may be closed, rather than moving them as originally promised. Kenney's statement also corresponded with a tweet from the Premier that outlines a much stronger tone towards supervised consumption, something closer to 2018 Jason Kenney rather than 2019 election year Jason Kenney. In his tweet, Kenney said that people have the right to be disturbed by these regressive decisions, leading to deteriorating neighborhoods, growing crime, and syringes filled with poison around our children and seniors. None of this is compassionate or progressive. And with this tweet comes a link to a Rick Bell opinion article. In this tweet, he also talks about the need for a balanced approach. But he is insinuating a balanced approach is one that hears voices that are calling to close safe consumption sites, rather than discussing the complicated conversation that discusses the balance between the benefits that supervised consumption sites provide to public health and the needs of the surrounding community. The article that Jason Kenney and the UCP tweeted out was a Rick Bell opinion article, which reflected a similar tone as the Premier's words. The opinion article uses strong and emotional language, painting people who are advocating for supervised consumption as zealots who believe in rainbows and unicorns. And the article insinuates these sites are a purposeful attack on the residents of the neighborhood. This piece stokes anger, fear, and resentment, not only towards the people who use the safe consumption services, but also the doctors, scientists, and other experts that have advocated for these sites. The rhetoric in this article certainly matches Kenney's tweet, and the tone is useful for the UCP because they need to overcome a significant amount of science and data that proves these sites are an integral part of the solution to drug use and addiction. One of the other interesting developments from this press conference is the clear splitting of the narrative using words that seem to mean the same thing, but actually mean something very different. In the election platform, the UCP signaled that they would favor treatment over harm reduction, and that they described this issue as a, quote, addiction epidemic, rather than an overdose epidemic, as the NDP and many other health workers have referred to it. The difference is subtle, but it points to the logic behind this strategy. If one believes this is an addiction problem, then people are addicted. They require long-term help. If one believes this is an overdose problem, then people are dying now, and they require harm reduction measures like supervised consumption. After Kenney's tweet, Bell's article, and the press conference of January 21st, there was a massive effort by all of the players who support safe consumption sites to draw attention to Kenney's comments and to defend against these moves in the public news cycle. The NDP responded with these tweets and articles trying to counter the messages of Jason Kenney and the article by Rick Bell. One of the articles tweeted out by the NDP contains a quote from Calgary Mayor Naheed Nenshi calling the idea to close the Schumer and not replace it terrible public policy. In the article, Nenshi admits that opening one central site in Calgary was a mistake, but he offers another alternative. Nenshi says that having multiple smaller sites will not concentrate all of the public disorder on one neighborhood, which would solve the original stated premise of the UCP's dislike of supervised consumption. Other experts weighed in as well. Dr. Elaine Hushka, assistant professor of public health at the University of Alberta, who has dedicated her career to studying harm reduction measures, showed stats from her own work that indicate these sites are having a positive impact on the number of overdose deaths in the cities that have them. So there was a pretty robust response when the UCP started to float the idea that these safe consumption sites could be closed. The next point in this competition occurred on the day of the release of the panel's report on March 5th. Some of the highlights of the panel report found that there were concerns by residents about increased needle debris, increased calls to EMS, and increased death rates near the sites. They found that there were increases in supervision of drug use that was not opioids, for instance meth use, that resulted in increased aggressive behavior around the sites. And they also called into question the overdose reversal stats put forward by AHS and the safe consumption sites, because they say there was no clear definition of an overdose reversal. Once again, it's important to note that the study purposefully excluded any positive effects of supervised consumption, as well as the impact of homelessness and drug use on the communities, which many critics of the report say is essential to understanding the problem. On March 6th, the day after the report, there were a number of criticisms of the panel report by doctors, health officials, experts studying the subject, as well as the NDP. All of these groups were responding to the UCP's communication strategy of highlighting disorder and chaos around the sites. There were charges of misrepresenting facts and using poor science or even no science to come to their conclusions. One of the major criticisms came during the panel's press conference when panel member Jerry Bannister Williams, who is not a doctor, she's a criminologist, interventionist, and addictions counselor, said that oxygen in many cases was not a life-saving intervention for a drug overdose. The report insinuated that the stats on overdose reversals and lives saved were inflated because oxygen was used instead of naloxone, the commonly known drug to reverse an opioid overdose, and that there were not clear definitions of overdoses and life-saving interventions. When asked by news media to help interpret these claims, some doctors said that oxygen is used as the first line of defense and is definitely able to help reverse an overdose because it can prevent a patient from losing consciousness and slipping into a deeper overdose. There is a feeling by all of the critics of this panel report that the report was politically motivated and should not be used as evidence to close supervised consumption sites. At this point, for much of the spring, the UCP's strategy was working. While the NDP was trying to defend against the report, the game seemed to be going well because Albertans were split on the issue and there hadn't been sufficient pushback by citizens against the report. With the COVID-19 pandemic, the public's attention shifted to the pressing matter of the pandemic, and this issue was far from most people's minds. But over the summer, this issue started to heat up with a number of incidents that reignited this issue. The UCP on June 18th made a bold play to halt the launching of a telephone-based supervised consumption service, just hours before AHS was going to make it available to the public. Associate Minister Luan had said that the program was, quote, dangerous and needed to be pulled at the last minute. The logic of this program was to address the problem that 80% of overdoses in Alberta happen at home. It was designed to assist people who live in rural areas or who were simply too far away to use safe consumption sites. The service was also supposed to address the UCP's main problem with safe consumption sites, which is a concentration of drug users around one neighborhood in the cities that have these sites. The intention was to offer a telephone service that would monitor people using drugs from home, and if an overdose occurs, the operator would send help to the person's residence. Associate Minister Luan defended against the criticisms of the move by saying that he didn't believe that the use of illicit narcotics with a support worker on the line is an appropriate intervention for drug use. And that it wasn't clear how long support workers should remain on the line and when it was appropriate to call emergency services and have them dispatched to the location. However, Alberta Health Services responded to these comments by saying that indeed there were clear protocols in place, and that by implementing these measures, AHS would be able to develop even clearer protocols as feedback from the new program was gathered. AHS also said the funding for the program was very competitive, and it wouldn't have gone forward with their partners like EMS, the City of Calgary, and TELUS had there not been sound protocols. Critics of this move also pointed out that similar programs have been applied successfully all over Canada, which led many to question why the UCP would shut down something that addressed their original root concerns with safe consumption. The NDP released many tweets on this subject, highlighting a continued insistence by the UCP that harm reduction measures aren't the way forward to the addiction overdose problem in Alberta. On the other hand, the UCP's social media sites had previously been quick to highlight some of their other moves about safe consumption to their followers. However, when they canceled the telephone safe consumption service, a potential middle-of-the-road solution that seemingly addressed concerns that people on both sides of the issue have with safe consumption, they didn't say anything on social media to their followers, which suggests that this move was something they didn't want to bring to the attention of their supporters. The UCP hit another snag with their communication strategy in June of 2020, when a study from nursing assistant professor Dr. Jennifer Jackson from the University of Calgary came out that started to push back against the findings of the review panel. The study presented quantifiable numbers that show the positive impact that safe consumption sites have on preventing overdose deaths. But the study also showed that in 2 years, supervised consumption also saved the province $2.3 million due to the decreased utilization of emergency services and hospital emergency rooms. This renewed calls by doctors and the opposition to once again scrap the panel report because of its very specific and some would say flawed mandate. This renewed calls by doctors and the opposition to once again scrap the panel report because of its very specific and some would say flawed mandate. The study also showed that 10 to 20% of people that access the Safe Work, Safe Consumption site in Calgary aren't taking drugs. They're inquiring about social programs and getting food, providing evidence to the contrary of the UCP's claims that these sites weren't doing anything other than handing out drugs. Another big moment in this competition, especially for the UCP, was the news that there were major signs of financial recklessness at the Lethbridge supervised consumption site, Arches. And the UCP got exactly what they were looking for, a reason to close one of the sites down. The UCP pulled grant funding for Arches, but instead of finding another operator for Canada's busiest supervised consumption site, which is in Lethbridge, they used the incident as an example of why harm reduction doesn't work. This incident was something that fit their narrative, so on their social media accounts, they let their followers know of the closure, and they also posted an opinion article once again from Rick Bell that would maximize the negative emotions they were hoping to create towards safe consumption. Once again, in the article, it was a decent dose of resentment towards the experts and researchers and the overall data that shows these sites work in curbing the negative health effects on society of drug use. Now, that's not to say that the blatant mismanagement at Arches wasn't deplorable, but the UCP's actions show a purposeful move to instill in their supporters a feeling of deep anger and resentment towards safe consumption. This was a good play for the UCP, because through this, they can encourage a sentiment that will make people more willing to opt for closure of safe consumption sites despite their benefits. This in turn helps the UCP because they are seemingly ideologically opposed to these sites, and the more ways that they can motivate anger towards these sites, the better it will be for their goals. The UCP also posted on social media calling the Lethbridge Arches site a money pit, and insinuated that the NDP might have known about the mismanagement at the site and were covering it up. Although it's important to note that the UCP were only made aware of this problem because of an anonymous tip earlier this year. After a win for the UCP in Lethbridge, they were once again put on their back foot. It was reported in September that the Supervised Consumption Review Panel became mired in a spending scandal of their own. Panel co-chair Bemister Williams, who months earlier accused safe consumption sites of inflating their data on life-saving interventions, was now being accused for allegedly trying to double dip on expense claims. It was reported that many members of the panel were told by government bureaucrats to stop spending so much on meals, but they continued anyways. Rob Knecht, former Edmonton police chief, overspent his allotted meals budget 19 times over 3 weeks. The irony of the UCP closing the Lethbridge Safe Consumption site for misuse of public funds, while its own Safe Consumption Review panel also misused public funds, was not lost on the media or the opposition NDP. The NDP released a number of memes highlighting the hypocrisy of the UCP's actions. This allowed the NDP more ammunition for their long-term communication strategy that everyone is feeling the pain of UCP cuts to services and the pinch of this recession, except for members of the UCP and their network of loyalists and appointees. The NDP also drew attention to the fact that the UCP were often perceived as the best stewards of the public's tax dollar, but in actuality have failed to be any better than the previous government. Another big moment in the safe consumption political competition emerged during late September with the release of Alberta's Q2 overdose numbers. During the summer, other Canadian provinces had released their Q2 overdose numbers, and they had seen a huge spike in overdose deaths as people were stuck at home during the first wave of the COVID pandemic, furthering the call for governments at every level to do more about this problem. Over the summer, the UCP mysteriously kept Alberta's overdose numbers from the public and didn't release the numbers during the summer months, even though that's what their provincial peers were doing. This approach led many to believe that the UCP were deliberately withholding the overdose numbers because they directly contradicted the political narrative the UCP were trying to maintain. Some credibility was lent to this theory because ultimately the UCP released the numbers without a press conference right before another big political event, the federal speech from the throne on September 23rd. Seemingly with the hope that this information would get lost in the news cycle of that event. Strategically, it was a good attempt to hide bad news, but unfortunately for the UCP, the newspapers and the NDP opposition seized on this issue and began pounding the NDP. Strategically, it was a good attempt to hide bad news, but unfortunately for the UCP, the newspapers and the NDP opposition seized on this issue and began pounding the UCP. Tweets that showed death numbers, Luan personally interfered with telephone harm reduction. Here's one saying that the UCP was intending to hide the numbers, with an opinion article asking why the UCP has no empathy for addicts. Here's one saying that the government knew this approach wasn't working. And this one calling these deaths preventable deaths. There were a number of articles that appeared over the next few days that showed the devastating effects this pandemic had on people overdosing in this province. The numbers seemed to indicate that 82% of deaths occurred from opioid cross-contamination with other drugs like methamphetamine and cocaine, posing problems for the UCP's communication strategy that maintained that the real problem was about opioid addiction. But this clearly shows that people were dying from drug use not just related to opioids and opioid addiction, but other drugs contaminated with opioids or used in conjunction with them. The storm continued around the overdose report, so much so that the UCP denied media appearances and interview requests for Jason Kenney and Associate Minister Luan on this subject. However, the UCP did have a number of written communication responses to this issue, saying that the numbers were in line with other provinces and that they maintained they were making investments in mental health and addiction treatment where it was most effective. In an effort to turn the tides against the criticism, the UCP decided to post a letter of support from a group called the Alberta Addiction Service Providers on their social media pages, as well as an opinion article written by the group that appeared in the Edmonton Journal. The Alberta Addiction Service Providers is a coalition of long-term addiction treatment centers. In the letter, they say that addiction service providers have, quote, never felt more supported by a government. Which is true because the UCP over the course of the last year have made a number of investments in long-term addiction treatment and hospital beds for recovering addicts as part of their election promise. It's likely that the UCP decided to post this because they needed some positive news on the subject, And by posting this letter, the UCP is trying to show that their approach doesn't lack compassion and that they're taking action on the issue. By posting this letter, they also continue with their interpretation of the problem, which states this crisis is an addiction crisis, and therefore supporting these long-term treatment providers is the best route to solving this issue. This is a good play because to someone who wasn't following this issue closely, they would see the letter from Alberta's addiction service providers and think the UCP was on top of the issue, even though in reality, the party's actions have been to transfer resources from one addictions treatment paradigm to another, and by doing this, they remove resources from the most immediate and effective service that's preventing people from dying, and then seeing huge numbers of overdose deaths on their watch. A few days later, into October, Jason Kenney appeared again to make more statements in defense of his government's response to the opioid epidemic. Jason Kenney responded to questions about refusing to guarantee a safe supply of drugs for addicts, something the federal government had advocated for, and made other comments saying that he wouldn't take further actions to curb the huge upticks in overdoses since the pandemic. Kenney's communication strategy was to continue with the strategy of highlighting investments in long-term addictions treatments. In the press conference, he also offered potentially confusing rhetoric designed to discredit safe consumption by saying that the greatest number of overdose deaths due to opioids was in the Greater Vancouver area, where there is the highest concentration of supervised consumption sites. However, after those statements were made, many doctors hit back at Kenney's response, saying it was false, and that overdose deaths in the Greater Vancouver area would have been much higher had these measures not been in place. Kenney also took a moment to blame CERB for the sudden spike in overdoses in the spring as well. The NDP hit back with a number of tweets. Their strategy was to once again appeal to the compassionate and rational side of people to pressure the government into taking action. This one says, the UCP is turning a blind eye to the loss of hundreds of Albertans as a result of opioid overdoses. And also a tweet saying the province has no new plans to curb fatalities. And the NDP mental health critic Heather Sweet calls these decisions ideological and that deaths will result from it. Prior to filming, the last play in this game took place on November 6th when Associate Minister of Mental Health and Addictions, Minister Jason Luan, announced that the UCP government was cutting the $40 per day cost of rehab in the province, furthering their commitment to the idea that treatment for addicts is the solution to the problem. This move to remove fees for treatment is a positive outcome for people who are seeking addictions treatment, which is likely a net positive to the citizens of Alberta. So this brings us to the end of the game. The game is currently ongoing, and there has been no clear winner between the NDP and the UCP on this issue. The UCP was able to score points by closing one of the 7 sites in the province over the course of this communications game, due to the misuse of public funds and poor management of the Arches facility in Lethbridge. But other attempts to shut existing safe consumption sites will likely be met with stiffer resistance, because the gross financial mismanagement doesn't seem to be a factor for many of the province's other safe consumption sites. But it has been interesting to see the range of tactics used by the UCP government to turn people against something that researchers, scientists, and even the Supreme Court of Canada say is a net positive to society. Now that we've outlined the political game that was played before our eyes, for citizens, what's needed to advance the debate beyond this childish discussion created by 2 political parties playing politics like a game with our tax dollars? The first aspect of this debate that needs to be discussed is the idea of addictions versus overdoses. All along, both parties had been referring to different aspects of the epidemic, with the UCP framing this conversation as one that was about addictions only, and the NDP and others were framing this issue about overdoses only. The issue of stopping overdose deaths is certainly the most immediate issue, but it's also important to have long-term treatment for those who wish to exit the cycle of addiction, which was previously limited and very expensive. And with that, all of the mental health, housing, and job opportunity help that would be required for someone to fully make the leap. Another interesting aspect of this debate that citizens should note is that much of the debate between the UCP and the NDP centered specifically around harm reduction versus long-term treatment. However, those are only 2 aspects of what modern social workers, call the Four Pillars strategy to drug policy. The Four Pillars is a multifaceted strategy that governments across Canada and Europe are using to more effectively deal with the complicated issue of drugs. The Four Pillars approach is prevention, harm reduction, treatment, and enforcement. Prevention deals with the prevention of the harmful use of drugs, alcohol, and other substances. Harm reduction, which discusses the ways to reduce the negative effects for those who use drugs, including measures to prevent overdoses and the spread of diseases related to drug use. Treatment, helping those with addictions problems get the necessary help they need to stop using. And finally, enforcement, to disrupt illegal drug supply chains and distribution and maintain peace and public safety. This paradigm acknowledges that there are many facets to combating this complex problem. And as the UCP is trying to heavily invest in treatment and enforcement while simultaneously stripping resources from the other pillars. As an example, here's a social media thread by Assistant Professor of the University of Alberta's School of Public Health, Dr. Elaine Hushka, as she outlines an example of why simply sticking people in treatment won't be a solution for people dying. Hushka says there is a high percentage chance of relapse with opioid addiction, and it may take multiple attempts by addicts to get off opioids. And when addicts relapse, the possibility of an overdose is even higher because of the user's tolerance to this powerful drug will have decreased in the time that they were clean. So when users relapse, reducing the harm of relapse on people who are trying to get over their addiction is a necessary step. And this is a good example of why treatment and harm reduction models need to work together, along with the other parts of the four-pillar approach, rather than our current political approach where one treatment is favored by one political party over the other, and resources are pulled once the government changes. In this video, we've spoken a lot about classifying the problem as an addiction problem or an overdose problem. But if we're hoping to get at the root of this issue, we're also going to need to understand the issue of opioid use versus opioid contamination. For most people, our biases towards drug use causes us to only focus on the addiction portion of the conversation. However, it's important for people to realize the important nuance of this debate. It's the fact that many people die of opioids but are intending to take other drugs because of the contamination of the drug supply. Because fentanyl is so potent, an amount of the pure substance the size of a couple of grains of sand is enough to kill someone. And all along the drug supply chain, trace amounts of opioids like fentanyl and carfentanil are finding their way into other drugs and poisoning people not intending to take opioids. This fact is something that's highly underrepresented in the mainstream discussion of this issue. Stats Canada says that roughly half of the opioid deaths in Canada between January and June of this year contained another substance. The two most common other substances were cocaine and methamphetamine. To highlight this fact, many music festivals in Canada have been recently offering drug testing on site to help create a safer environment for their patrons, instead of getting caught up in the moral discussion around drug use. Because they know that the politicized conversation is leading to half measures or inaction, and half measures and inaction, in this case, leads to real people dying. Finally, how you do something is just as important as what you do. And in this case, the UCP is making a case for long-term treatment, which is commendable. But the way they're selling it to the public is by trying to kick up anger, fear, and resentment. They softened their rhetoric around the issue during the provincial election and then became hostile towards safe consumption once they were comfortably in office. They are withholding information like the strategic withholding of Q2 overdose numbers and trying to slip it into a busy news cycle. They are crafting and pitching misleading and politically motivated statements like Vancouver is the epicenter of drug deaths so harm reduction doesn't work, or like saying that oxygen isn't a life-saving intervention for drug overdoses when doctors say that it is. All of these tiny statements are purposely designed to mislead people who don't have a detailed knowledge of the issue, which, due to the complexity of this issue, is almost everyone. They're shutting down or obstructing treatment programs like the telephone supervised consumption service that have worked well in other areas of the country and provide a fix for the UCP's original stated criticism of supervised consumption. The UCP is using tricks like panels with biased participants and a limited scope of study that are designed for political show and are purposefully designed to provide the answer the government is looking to promote. The UCP are also trying to find ways to discredit scientific evidence and encourage resentment and anger towards social workers, healthcare workers, health professionals, researchers, scientists, and others who are dedicating their lives to trying to solve a very pressing and poorly understood problem plaguing our society. All of these moves may be viable political strategies in modern politics, but they also erode the trust in elected officials and governments in the long term. Will the citizens of Alberta find all of these actions an acceptable strategy for a government that supposedly represents them? Do the citizens of Alberta think that these tiny techniques to nudge public support towards outcomes the UCP favors is a responsible governing technique? It will be interesting to see, as the battle will likely continue on into 2021 and beyond. Thanks for watching, everyone. Please like or share this video, and please follow us on social media. Thanks so much for watching, and we'll see you all again soon. Take care.